Hi everyone, my name is UMAIRAH FARISAH and my matrix number is 210177.
Hi everyone, my name is NURUL. I'm an AFIQAH BINTI NORAZIRUDDIN and my matrix number is 210213.
Hey, hi everyone, my name is NURUL. I'm BINTI ZAINAL ABIDIN and my matrix number is 20987.
Hi everyone, my name is JOCELYN and my matrix number is 213031.
Hi, my name is FITRI ARIFFIN. My matrix number is 203863.
Okay, so we are from group 4 and we are going to do a discussion. So as we all know, smoking is the act of inhaling and exhaling the fumes of burning plant materials. So we're going to discuss about smoking should be banned in all public or not. So we all may give our opinion about this. Is everyone ready to start our discussion?
Yes, I'm ready.
Yes.
Okay. So want to start first?
So I suppose we can start our discussion now.
Yes.
Yes.
You may.
Yes.
Okay, so first of all, everyone, I would like to share some facts that I read on the internet. May I?
Yes, AIMAN, please continue.
Okay, so based on what I have found, the most comprehensive data on global trends in smoking highlights its enormous global health toll. The number of smokers worldwide has increased to 1.1 billion in the year of 2019, with tobacco smoking causing 7.7 million deaths, including 1 in 5 deaths in males worldwide. So, using data from 3,625 nationally representative surveys, the 3 new studies published in the Lancet and the Lancet Public Health by the Global Burden of Disease Collaboration provide global estimates on smoking prevalence in 204 countries in men and women aged 15 and over, including age of initiation, associated diseases, and risk among current and former smokers, as well as the first analysis of global trends in chewing tobacco use.
Oh, wow. That's really a lot of important fact that I learned today.
Yes, I also feel that way. Sometimes we only know the news in our country only, but hearing this worldwide issue today is shocking. I can't believe this.
Indeed, it is. So what I'm trying to say now is smoking really does take a toll on our health. It is surely is going to be more dangerous when we see so many people nowadays smoke in public, where non-smokers also inhale the toxic materials found in the smoke.
Exactly. I also agree with that. Can you imagine the smoker doing this in public and not even think of anyone else? It's selfish, especially when there are babies, kids, adults, and so many people from all ages inhaling it. It could be that it could be bad to us and affect our health in so many ways.
Yes, I agree. But I didn't quite get what you meant by it could affect us in so many ways. Do you mind to explain it further, Ain?
What I was trying to say was it could affect our health in so many kind of diseases. For instance, smoking can cause cancer, heart disease, stroke, lung disease, diabetes, and chronic obstructive pulmonary disease, which include emphysema and chronic bronchitis. Smoking also increases risk for tuberculosis, certain eye disease, and problem of the immune system, including rheumatoid arthritis. These are critical diseases one could get. It affects both smoker and non-smoker in ages. Did you get what I was trying to say, or should I explain?
Yes, I get what you mean. Somehow, I feel like smoking should be banned in all public places. We really should be strict with this since this can be dangerous to our health. I believe that none of us would want that, right? For our people in the country to be sick.
I agreed so too. In order to establish a good environment in this country, I believe that we should take action now. People always say it's better late than ever. But for these serious cases, I may say we should not be late before the situation worsening.
Yes, exactly.
Yes, I agree with both of you. In my opinion, smoking should be totally banned in all public places because smoking brings many health risks to both smokers and non-smokers. Smoking does not only affect the smoker negatively, it also affects all the people around those who smoke in public places. Because when someone smokes in public places, the smoke will travel everywhere through the air and it can stay in the air for several hours after somebody smokes. And secondhand smoke is dangerous to anyone who breathes it in.
Yes, I agree with you. However, I do not really understand what you mean. Can you explain it in more detail?
Sure, Fitri. What I meant by second-hand smoke is the combination of smoke that comes from the cigarette and smoke breathed out by the smoker. When a non-smoker is around someone smoking, they breathe in the second-hand smoke. And second-hand smoke is dangerous to anyone who breathes it in. Health risks are much more to non-smokers because they may double up mainly to those who already suffer from other diseases such as heart and lung problems. As I mentioned earlier, smoking will cause lung cancer, heart disease, and breathing problems even if you inhale second-hand smoke. And better on what I was trying to say, or should I explain further?
Yes, I understand now.
May I interrupt?
Yes, sure.
I feel like there are so many benefits we may obtain if we seriously take this issue into account.
I strongly agree with you, Fa.
For many people, smoking becomes a source of comfort, stress relief, still does not counteract the numerous health risks, including asthma, cancer, and not to mention the damaging effect of nicotine. But one of the reasons it's so hard to quit smoking is that many people believe that cigarettes help them cope better with life. Here are a few more reasons why the act of smoking may seem appealing. First is the bonding with other smokers. Second is the feeling of creating a ritual. And the third one is the momentary gratification.
May I add some more points?
Yes, of course you can.
I feel that everyone will benefit from a healthier lifestyle if smoking is prohibited in public places like restaurants. People will view it as an endorsement of living a healthier lifestyle on the part of the government for everyone. This is due to the fact that the government is sending the message that it cares about the health of the citizens by prohibiting smoking in public areas. Additionally, the government is discouraging people from smoking by sending this message. When smoking is prohibited in public place, it serves as a constant reminder to people of the significance of maintaining good health. It serves as a timely and important reminder to all individuals that the government is deeply concerned about the health and happiness of fans of this.
Yes, I couldn't agree more. May I ask a question then?
Yes, you can. Please do so.
I strongly agree with both of you, FARISAH and FITRI, about the benefits. However, I am wondering what is some way we can implement in order to really successfully ban smoking in public places?
I feel that we should do everything in our ability and power to prevent this issue from rising over and over again. For example, prevention can take the form of policy level measures such as increased taxation of tobacco products, stricter laws, and enforcement of laws, regulating who can purchase tobacco products, how and where they can be purchased, where and when they can be used. Example, smoke-free policies in restaurants, bars, and other public places, and restriction on advertising and mandatory health warnings on package. Over 100 studies have shown that the higher taxes on cigarettes, for example, produce significant reduction in smoking, especially among youth and lower income individuals. Smoke-free workplace laws and restriction on advertising have also shown benefits.
May I add some more as well?
Yes, please. I would like to hear more about this.
Okay, prevention can also take place at the school or community level. Merely educating potential smokers about the health risks has not proven effective. Successful evidence-based intervention aim to reduce or delay initiation of smoking, alcohol use, and illicit drug use, and otherwise improve outcome for children and teens by reducing or mitigating modifiable risk factor and bolstering protective factors. Risk factors for smoking include having family members or peers who smoke, being in a lower socioeconomic status, living in a neighborhood with high density of tobacco outlet, not participating in the team sport, being exposed to smoking in movies, and being sensation seeking. Although older teens are more likely to smoke than younger teens, the earlier a person starts smoking or using any addictive substances, the more likely they are to develop into an addiction. Males are also more likely to take up smoking in adolescence than females.
I see. So I think what are you trying to say is we should prevent and educate people from young age, right? So that people will not smoke in public.
Yes, exactly.
I would also like to add some here. I found that from studies, some evidence-based intervention show that lasting effects on reducing smoking initiation. For instance, communities utilizing the intervention delivery system, communities that care for students aged 10 to 14, show sustained reduction in male cigarette initiation up to 9 years after the end of the intervention.
Wow, this is very fascinating to hear, and I feel that it opens our mind more, I believe. So, let me recap the important points in our discussions this time. So, in order to prevent and ban smoking in public places, we should take actions by first way is prevention in policy measure level, where the government in our country can increase tobacco taxes, and this also can be done by school or community level prevention by doing intervention. So this may help in delaying initiation of smoking, that at least the amount of smokers could be reduced. Am I right?
Yes, you are right. Those are main points are correct.
So does anyone wants to add anything or have anything to say?
I think no.
Okay then. So after listening to the opinions presented in the discussion, the majority of us have agreed that smoking should be banned in public places.
Yes, that is right. So shall we try to sum up everything from our discussion now?
Yes, I am.
So as a As a conclusion, all of us agree that smoking should be banned in the public places since it brings a lot of negative effect to us, especially to our bodies. Body's health and strict action should be taken in order to ban smoking in all of public places.